Vincent Jagongo, Member of County Assembly for Northwest Kisumu Ward and Chair of Health, Housing and Sanitation, Kisumu County Assembly. I want to say that we've been working with the Alliance more so in matters of sexual and reproductive health and family planning, matters on sensitization of budget making process, and also advocacy on the importance of a good governance as Kisumu County Assembly. I think the Alliance has helped quite a number of members. Most of us have come from different backgrounds, and not all of them are in the medical field. And it has, I can say that it has empowered most of the members on areas of the importance of how to doing budget making process, the importance of having a budget for sexual and reproductive health issues. The enrollment as we speak is around 90,000 out of the total population in Kisumu County. Those who have been enrolled to get services from HAWA, around 90,000. So in a scale of 1 to 10, I would give 6 over 10. One of the bills, it's now an act, that is Kisumu County 2019 Health Act, that was fully supported by the Alliance, and I think it's now in operation. And there are also some 2 bills that are coming to the Assembly. The one dealing with the CHVs, Community Health Volunteers bill, and also the FIF bill dealing with the Facility Improvement Fund bill. Because we've been having issues with the UHC on medicines. During the UHC time, we used to get medicine from the KEMSA, and it was like when they don't supply medicine to the hospitals, we could not have medications. But then those are some of the gaps that we saw during the implementation of the UHC, and I believe the FIF bill will help to bridge that gap, because we are going to retain some amount of money at the hospital level, at the lower levels of the hospitals, that can be used to purchase medicine and other medical items within the hospitals. So that one will make the hospital run without shortage of medicine and shortage of medical equipment within those hospitals. So the FIF bill will help create some funds that will be retained by the hospitals within the community, that will be used to support the operations of those hospitals. Unlike at the moment, where all money that supports hospitals must be gotten from the executive or from the Department of Finance at the executive. The money that has been allocated to support the sexual and reproductive health is not sufficient, has never been sufficient. But I'm happy that it has been moving from stage to stage. When we came in, they used to allocate 19 million for the whole county to support in the reproductive health. But now it has moved from that 19 million to 42 million. The last budget was 42 million. And I believe this coming budget, it may even go higher than 42 million. So there has been an increment year after year. And that one has been achieved because of the support that we are getting from the partners, the Alliance partners, who are supporting in advocating for more funds to be put in this budget. So I can say that it has never been sufficient, but if we continue advocating for more funds to be put, more so sensitizing our community during budget making process, the importance of having money in that docket, I think that one will help us, and also will help more members to understand that we need to have good money in that docket. The budget, whether it's grant or the own source revenue budget, we have only one budget. So once there is money from THS or from any other grant, we cannot double allocate. So we count it as part of the budget that is there. But I believe through the advocacy and through whatever we are doing, even if that one stops, even if the donor funding stops, the counties will still be able to allocate money to that docket, because I think there is a vote head for reproductive health, though it has been going nil-nil because of the donor funding. But once the donor funding stops, we'll have to put something as a budget for that vote head of reproductive health. I think it's important to plan for the population of our people. And that's why it's also important to have budget for FP commodities, which has been missing in the county. So it's a good idea, and I support it, that we need to have a budget line for the FP commodities, because we know with a planned population, we need to plan for our population, and we know what the FP commodities does to our people, and it's something that we need to have. Even the one that is being supplied by the KEMSA, they are missing some of the FP commodities. Like, if I may give example, nowadays you don't have the depot injection. They are not there because the KEMSA do not supply them. Because with the KEMSA, we only use what they supply. So it means what they don't supply, we may not get. So most of our women end up going to the private hospitals to get these commodities. So if we can have them within our facilities, the better for us. So it should be in the budget so that we get them in our hospitals, and we allow our women to get them, because the ones in the private hospital, they have to pay for them, and some of our women cannot afford to pay for these commodities, so leaving them vulnerable for unexpected pregnancies that we are experiencing within the county. So it's important that we have them. Just to improve on, we need to scale out our advocacy to the lower level in the community. Like at the moment, we are having, as Kisumu County, we are having the lowest level as a village. We are headed by the village administrators. So we also need to move to the villages and have this advocacy in the villages. Again, we also need to have more engagement with the legislators, because at times they are the ones who are making these laws. So once they are sensitized well, they'll help us to also to do the advocacy when it comes to matters of reproductive health and family planning. Even within the assembly, or when their budget is being made, they can always lead by also sensitizing other community members on the importance of having these issues or these committees within the budget. I think this is real-time information, and you are able to assess that information that has not been altered. So it's important to have alternative media as partners.